Hi everybody, Jack from Taped Up, and this is week 5 of our mini-series, Common Injuries in Sport. Josh, today what injury are we looking at?
We're going to look at a Patella tendinopathy, a very common injury in both rugby and football.
Okay, so tell me a little bit about the symptoms and the causes.
So whereas our other injuries in the last 5 weeks have been about trauma and things rupturing, this is very different. This is an inflammatory-based condition which can cause quite a lot of pain at the front of the knee. In particular, the patella tendon. The patella tendon sits just below the kneecap. So some of the common symptoms are quite a lot of pain at the front of the knee. So if I was going to assess this in clinic, I can directly palpate the patella tendon. It'd be quite painful to somebody. Also in deep flexion, it can be quite sore because you're stressing the tendon quite heavily. And also on deceleration tasks, as you step and decelerate and put quite a lot of torque through the patella tendon, you might get quite a lot of pain. Basically, you've got a fat pad behind here, which can become inflamed alongside it because you've got an inflamed tendon. You might get a little bit of puffiness or a little bit of swelling around the area. So it's very important from a physio perspective to try and differentiate between a patella tendinopathy and maybe something going on with the fat pad because they both treat very differently. The products we're using today are a 5 centimetre EAB and a 3.8 centimetre zinc.